everyone. Today's topic will be our Dental Health Month subject, which will be about protecting your bright and healthy smile. And we have Julie here from the dental team who will be presenting more on this topic. So, Julie, whenever you're ready, you can go ahead and take it away.
Good morning, everybody. Thanks for joining us today. We're talking about protecting your bright and healthy smile. So just a disclaimer, the guidelines set forth herein are provided for informational and educational purposes only and do not constitute medical advice. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something you have read on this website. In the event of a medical emergency, call a doctor or 911 immediately. Okay, so to start off, some of the things that we recommend, that our dental team recommends for overall cavity prevention is we would like to see kiddos now looked at to have their first dental visit by the time their first tooth erupts or their first birthday, whichever is first. Of course, fluoride is always a benefit. Brushing 2 times a day is something that we definitely recommend doing, as well as flossing the teeth once enough of the teeth are present in the mouth and touching one another that the toothbrush can't clean everything sufficiently enough. You want to get in there with those little floss picks for the kids' teeth. Diet is always going to be a factor, what they're ingesting and consuming. Transmission of bacteria, which we'll talk about a little bit later, teething, sippy cups, oral habits, and the acid attack process. Okay, cavity causing bacteria. So things that are transmitted in saliva, bacteria is transmitted in saliva by sharing objects like utensils, cups, toothbrushes, bottles, pacifiers, and dishes. So we always recommend, a child is born basically with a sterile mouth, and how they get the bacteria, lots of times it will come from parents kissing the child. Maybe if the pacifier falls out of their mouth on the floor, you'll sometimes see a mom licking it and then giving it back to the baby, things of that nature. So any type of sharing of utensils, toothbrushes, pacifiers, anything like that, we recommend staying away from. So that's how bacteria could be transmitted from us to our children, or, from siblings or other caregivers to our kiddos. All right, how often we eat sugar matters more than how much. So if looking at this particular slide here, on the left-hand side, you'll see normal meals versus snacking and grazing. So we talk about and the acid attack process. So every time you ingest some type of sugar, whether it be a beverage, food, a carbohydrate that then turns into a sugar, anytime something like that takes place, when the sugar bacteria reacts with the bacteria that's in our mouth, an acid is produced as a byproduct. And then that acid affects the overall pH of our mouth. And we end up giving our teeth a little bit of an acid attack for about 20 minutes with each sugar exposure. So if we're just having sugar in conjunction with our meals, or we're getting into those lower pH zones and in conjunction with our meals, we're not as concerned, because you could see you're only in the danger zone for in a limited amount. Whereas if you go to the next slide on the right-hand side, you could see with the child that is doing a lot of snacking and grazing in between meals, you could see how often we are dipping down into that danger zone. So in comparison over here, where we only have 3 dips, and for the most part, the enamel is in a safe zone as far as the pH is concerned. When we go over here and we see the kids are nursing juice boxes or sippy cups that contain some type of a sugary liquid, or even just snacking, in between meals, they're getting a lot of sugar exposures between, over the course of the day. And that is going to make them more susceptible to cavities as well. All right, so what causes cavities? No fluoride causes cavities, and that's is a little bit controversial. A lot of people have some different opinions on that, but starter toothpaste for the real little ones does not contain any fluoride, and we don't recommend them having fluoride until, they're able to spit without swallowing. And I don't know if we saw it or if I accidentally skipped over oh no, we didn't really talk about it, but on this first slide here, you could see this is the amount, like a smear layer in comparison with older kiddos from like 3 to age 6, you could go with a pea size amount. But even for kids, it's still that are a little bit older, you're still talking about a very small quantity of fluoride. So if they are in fact swallowing any toothpaste, it's pretty insignificant. Okay, so fluoride is important. Poor oral hygiene routine, so maybe parents aren't following up with their children to make sure that they're brushing effectively, because we know kids can't, their idea of brushing is just in there for a couple seconds and then they're done. They're not very thorough, so we always encourage parents to follow up and make sure that the kids are doing a good job. Limiting the amount of snacking in between meals, eliminating a high sugar diet. We don't want to see them take any sugary drinks to bed at night. So the only thing that should ever be in the crib with the child in their sippy cup is water. Again, the transmission of oral bacteria causes cavities. And we talked about that before with the transmission of like shared utensils and whatnot. And then caregivers with dental anxiety, that if parents or grandparents or any type of caregiver has a dental phobia, oftentimes that fear tends to be inadvertently instilled on the child. Not that they're trying to make the child fearful, but they just use maybe terminology that, they think is appropriate, but maybe isn't appropriate for the kids. So we just often caution parents that do have some type of a dental fear or phobia to really try to not instill that fear of going to the dentist on the kids. We really want to build trust with them and let them have a positive experience from the time that they're very young, because the only way they're ever going to let us do anything in their mouth is if we do build trust with them. We want them to know that coming to the dentist is fun, and generally speaking, if they come on a regular basis, it is pretty fun. And then, of course, delay in seeking a dental home. Again, going back to that first dental visit that we talked about, the time that the first tooth erupts, obviously there's not going to be a lot that we're going to be able to do, with a child that has one tooth, but we want to, again, build trust. We want to get them established, kind of have a baseline, and then just get them into the routine of coming in. That way, as they get more teeth, they're going to be more, they're just going to be more accommodating to let us do what we need to do when they're used to coming in and they go to the treasure chest, and they're just going to be willing to participate with all of the things that we ask them to do if they think that it's fun and they've had good experiences up to that point. So we want to, again, see them get a dental home as early as possible. And then plain water is best in sippy cups and in between meals. Talked about that. And then here we're just as a quick look of healthy versus unhealthy teeth. Now, early signs of cavities, you might notice along the gum line here, some like white chalky spots. That's what a cavity starts off with in its very like early stages. As it progresses, it tends to darken, but initially you'll notice the white chalky spots. And then the gums, many times you'll see some excessive redness in the gums as well, but in comparison to healthy teeth with no white spots over here, you could see the gums are nice and pink, the papilla is nice and pointed in between. It's just a nice healthy mouth in comparison to over here. We've got a little bit of redness, the gums are a little rolled, not quite as pointy, but more than anything are those white chalky lesions that are forming on the teeth. And then here is our Geisinger Health Plan dental service line. We are in the office Monday through Friday, taking phone calls from 8 to 4:30. You could reach us at toll-free 833-589-2194 or 570-849-7915. There are 11 of us hygienists throughout the state. So calling that number, you'll get one of us. And if somebody is not able to help you, we will get somebody that is able to. Because we all have different regions. So depending on where you're calling from, if the area that you're calling into is not the region that you're calling about and we're not able to help you, we're going to get in touch with the hygienist that covers your region and just make sure we help navigate you to a dental office that's convenient for you guys.